Sleep apnea is really common disorder. In men, probably 50% of men have sleep apnea in the Western Hemisphere. Sleep apnea is where there's cessation or stopping of breathing at night. And so you're sleeping, all of a sudden you stop breathing. Initially you snore, that's partial closure of your airway, and then you close it all the way, and we call that an apnea. Incredibly common, incredibly dangerous, often resulting in things such as low production at work because of lethargy and listlessness from sleepiness, to motor vehicle accidents and danger on the roads, not only to yourself that's driving because you're sleepy, but others that are innocent victims. Also, sleep apnea can cause high blood pressure, which can lead to myocardial infarctions or heart attacks, strokes. Sleep apnea is a very dangerous and an expensive and often long-term sequelae that could be very limiting to patients if not treated. Sleep apnea is diagnosed by having a sleep study. So you go into a sleep lab, 7:30, 8 o'clock at night, you relax, you get some wires put on you to check your breathing, your oxygen, your EKG, and then you go to sleep at night. And while these other variables are being monitored, you're sleeping. The way we treat sleep apnea is commonly we treat it with what's called CPAP, continuous positive airway pressure. It's a mask, and really today we have a lot of innovation in the mask that we use. We used to use a bigger mask. Today we can have small masks that are just like supplemental oxygen masks. It seems like it would be very difficult or arduous to sleep with a CPAP machine. Patients swear by it. Patients that have sleep apnea, that have poor daytime alertness, poor productivity, many of them say they're addicted to their CPAP machine because it allows them to sleep normally. It allows them to get deeper sleep, allows them to be more refreshed during the day, allows their blood pressure to be better controlled. That's one treatment. The other treatments are surgical treatments. You can have your tonsils removed, deviated septum fixed. You can have your jaw moved forward. Other things are these little mouthpieces. The mouthpieces basically you put in your mouth, pulls the lower jaw forward, leaves a little bit more room in the back for breathing. So generally, if a sleep doctor sees these patients, we can figure out what's best for the patient as to how to treat them.